Hi, my name is Melanie Spangler. I'm going to be doing a physical assessment on Jordan Puente. Jordan is a 23-year-old Caucasian female. Her vital signs were taken prior to this assessment. Her temperature was 98.4. Her pulse rate was 96. Respirations were 18. Blood pressure 124/70. She is 5'5", weighs 218 pounds, and has a BMI of 36.3. She's appropriately dressed for the assessment, has no signs of distress. Her skin color is pink, warm, and dry. She has tattoos, no lesions. Piercings are noted in the ears and the nose. Her hair is appropriate texture and is equally distributed. No infestations are noted. She is normocephalic. She has peripheral pulses 2+ radial and pedal pulses 2+. Capillary refill of the upper extremities are less than 30 seconds, and the lower extremities also. I will now assess her lymph nodes. If you could rotate towards me, please. Her lymph nodes are palpable, not enlarged, soft, not tender at all. Right, you didn't have any tenderness with that. Her trachea is midline, and it is an appropriate position. Carotid pulses are 2+ bilaterally. Thyroid is non-palpable, non-tender. This is her. Your eyelids, they open and close appropriately. Pupils are equal and reactive. Pupils are equal and reactive. Her sclera are white, no redness noted, and her iris are brown. The ears are well formed. They are not low set at all. The nares are patent. No external abnormalities of the nares. She does have a piercing, as noted before. You're able to appropriately breathe in and out. Her septum is without deviation. Mucosa is pink. It is moist. Frontal and maxillary sinuses are not tender, non-palpable. Her gums are not bleeding. Teeth are clean and intact. No caries noted. She has no braces or dentures. Tongue and the floor of the mouth are pink, moist, with no lesions. Uvula and soft palate are symmetrical and rise and fall. Now we'll move to respiratory assessment. I will assess the rate and the respirations for 30 seconds. There's no labored breathing, no retractions, the depth is adequate. The diameter of the chest is appropriate, she's not barrel chested. And now I will auscultate the apex of the lungs, in and out, please. And bilaterally. And the bases. No adventitious breath sounds are noted. Lungs are clear bilaterally. I will now listen to the posterior. lungs are clear, you're not having any difficulty breathing. Okay, next I will evaluate your cardiovascular system. I will listen to the apical pulse for a full minute. I will palpate the point of maximum impact of the heart. I will listen rate is now 90. S1, S2 noted. No murmurs or gallops or rubs. Patient was auscultated the mitral valve, pulmonic valve, tricuspid valve. No problems noted. I will now inspect her abdomen. The abdomen has no scars noted. Contours appropriate. I'll now listen to the 4 quadrants for active vowel sounds. I'll now percuss the abdomen. And now palpation. No masses noted. Abdomen is soft and non-tender. Correct? Mm-hmm. I will listen for an aortic grooving. Noted. Help you sit up now. We'll check for CDA tenderness. Tell me if this hurts. Nope. Nope. Looking at the spine, she doesn't have any scoliosis noted. No other abnormalities. Her muscle mass is appropriate and symmetrical. Her joints have appropriate range of motion. If you can move your arms and legs for me. Okay. You need to test some grip. Push against one hand. Okay, now hold your arms out straight. Push up. Okay, push down. And do the same with your feet. Up and down. Okay. Now we're going to check your cranial nerves. I will check the olfactory nerve. Do you have any problems smelling? Have you had any problems with that? Okay. Optic nerve, I would check visual acuity by checking the Snellen chart. We've already assessed cranial nerve number 3, the oculomotor, with the Perla evaluation. 3 and 4, I would check the cardinal fields of gaze. Cranial nerve 6, if you'll close your eyes please and tell me if what I'm poking you with is sharp or soft.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft.
Okay. That would be the trigeminal nerve. The facial nerve, I'm going to have you wrinkle your forehead. Okay, if you'll raise your eyebrows. If you can squeeze your eyes shut, puff your cheeks out. Smile for me, and frown. Okay, and the acoustic or eighth cranial nerve is a whisper test. I'm going to whisper a word in each ear if you'll repeat it to me.
Jordan. Jordan.
We're going to check the vagus nerve, which is the rise and fall. Do you feel like it? Say okay. Can you do a shoulder shrug for me? Okay. The SS is the spinal accessory, cranial nerve number 11. And the hypoglossal is a tongue. Stick your tongue out for me. Move it side to side, please. Okay. Okay, we're going to check tendon reflexes now. Okay. Okay. If you can hold your hands out to the side for me and close your eyes and touch your finger to your nose with your left hand and back, and your finger to your nose with your right hand and back. Okay, thank you. Okay, now if you can stand for me. And you're going to do a heel to toe walk. Okay. And then now touch your heel to your shin and drag it up your shin. Okay. Patient is able to do those tests. That completes our assessment. Thank you.